Hi, my name is Ashley. Right now I will be performing the task of placing an e-collar on a patient. This is my patient Romeo. I do have my OCCI certificate hanging on the wall over here. So the first thing that I would do is select an e-collar. I have selected a size 10 e-collar. The ones that we have 3 rungs that can either tighten or basically enlarge or tighten the diameter of the cone. So you want to make sure that you are able to slide the cone over the top of the head. And then you also want to be sure, especially for things like surgical patients, that the patient's nose does not go past the end of the e-collar. Now with our e-collars, we typically use a piece of gauze here to wrap around so that we can tie to their neck. It is very stretchy. Sometimes we can also loop the collar through it, or we can use the gauze and loop the gauze through the collar as well. So with this patient, I will slide the cone over the head like so. I will also be sure to pull out the ears. Then I will take my gauze and I'll tie it in a bow tie. I'll tie it tight enough that I can fit at least 2 fingers underneath, and this will ensure that the patient will not be able to get the e-collar off. So now that I've tied it, you can always give it a little tug. You want to be pretty forceful with this tug, yet gentle, just to make sure that the animal cannot get it off, because a lot of animals will tug or chew really hard at this to get it off. Then you just want to really make sure that you can watch them, make sure they're not struggling with breathing. You can check by their mucous membranes, respiratory rate, things like that. And then for removal of the e-collar, you can just untie this, and then you can just pull it right off their head like that.